In the past, we were used to treat patients with early MD in our department with ARES, with supplements and observation. Now we want to involve more the patients in their disease, so we really go through a full explanation, and in most of the patients, especially they have somebody in the family which is affected by atrophic AMD in the late stage and choroidal neovascularization as a complication. We suggest them to get a genetic test, to change their style of life, to avoid an excessive exposure of the ultraviolet, and to be in constant contact with somebody that can take care of the dietary, and in order to reduce the risk of progression. The patients that have no experience in their family, they underestimate their risk. But the patient that has already somebody which is seriously affecting their family, they are not doing that. But sometimes they're not following our instructions, they are taking whatever is available in the market. They go through the internet, they start doing everything, starting from pills until to yoga sessions. This is not what we are recommended. We have developed a very complete and scientifically based platform for evaluating and follow the patient before doing anything. The platform consists of first a visual acuity examination with the ATDRS, then a morphological analysis, what we perform with the spectral domain OCT. We use in some cases where there is a higher risk fluorescent angiography, ICG angiography, and routinely also angio-OCT. Then we have a panel that is completed by a genetic testing. We perform microperimetry, we perform FDT analysis for the central sensitivity, and we are prepared to work in combination with the genetist, with our response, and with electrophysiology. What does it mean that? We already moved to the so-called personalized medicine. We will reduce the risk, it will improve the treatment. We have added 2RT laser treatment to observation. And we have achieved some preliminary, very impressive results. We add to all this platform the result achieved with electrophysiology that have proved until now an increased response of the function of the rod and cones after the 2RT treatment. If we will have a larger collection of patients confirming this data, then we will probably change our attitude, and we will consider 2RT as a part of the routine therapy for this patient, leading to a substantial reduction of progression of the disease, and in some cases, as it looks like, a partial regression.